Okay, today this topic coming under the your topic subject theory paper. It is the psychiatry. That's the theory paper you need to study in the first year of MPhil Clinical Psychology. So this is another topic coming under psychiatry paper, that is Liaison Psychiatry. So today I will be talking about what is Liaison Psychiatry. So I'll be talking about what is the definition of Liaison Psychiatry and how the Liaison Psychiatry come into picture, that is history, and what is the current position of Liaison Psychiatry, roles and responsibilities, comparison, and what are the different models of Liaison Psychiatry, how to work in general hospitals, patients presentation and classification, how it contributes the research, teaching, and how we can make it more cost effectiveness. So I'll be covering these topics in different classes. Today I'll be talking more the basic aspect of the class aspect of Liaison Psychiatry. These are the examples of patients. It's not that when a patient came to our hospital, it doesn't mean that they have only one single problem. Probably they're coming with the BP, but they also report that, yeah, I am not getting sleep and I'm getting very anxious, I'm distressed. So of course patient came for cardiology, but they also need assistance from the psychiatry. Fine. And another person may be having chest symptoms, but they may be going through addiction problem like heroin problem. So they may say that, yeah, I am also going through this heroin issue, so I need to get treatment for that also. There comes the importance of Liaison Psychiatry. So just that when they have multiple, a patient can present it with multiple different issues, there comes the importance of Liaison Psychiatry. So as I said, these scenarios are very common in general hospital. So all doctors, not only psychiatrists, need able to recognize and treat common conditions such as depression, anxiety disorders, substance abuse and all. So there comes the importance of consultation Liaison Psychiatry. So what is the definition? Consultation Liaison Psychiatry is a subspecialty of psychiatry that incorporates clinical service, teaching and research at the borderland of psychiatry and medicine. So consultation Liaison Psychiatry is derived conceptually from the old tradition, which advocates a ceaseless dynamic interaction between mind and body. So basically licensing, we are licensing between two departments. That means licensing means we are making association, okay, bonding. So with the other department. So here we are saying that, okay, though they come with a different problem, we are licensing with the psychiatry. So here it reflects two interrelated roles of the consultants. There are two people are there treating the patient, and one may be a cardiologist or pediatrics or whoever it is, and other person is the psychiatrist. The consultation refers to the provision of expert opinion about the diagnosis and advice on management regarding a patient's mental state and behavior at the request of another health professional. So basically consultation, patient comes for a consultation, they want treatment. So basically what is consultation? Consultation means the expert is providing the opinion about the diagnosis. What is your diagnosis? And advice on management regarding the patient's mental state and behavior at the request of another health professional. So another person is telling that, yeah, this person is also suffering from some other symptoms, so please give a diagnosis, please evaluate, give an opinion, and then treat. The term liaison refers to linking up of groups for the purpose of effective collaboration. So basically it comes liaising, as I said, the association or the collaboration. So between the two different departments, two different health professionals. So what is liaison psychiatry? Liaison psychiatry, also known as consultative psychiatry or consultation liaison psychiatry, is the branch of psychiatry that specializes in the interface between between other medical specialties and psychiatry. So simple way we can say that it is the association or interface between medical specialty, other medical specialties and psychiatry. Consults are also called when the primary care team has question about the patient's mental health and how the patient's mental health is affecting his or her care and treatment. This is another term used to explain that consults. That means, as I already explained, that when the patient, we know that patient is primarily came for a particular problem, but then patient is also suffer from with the other disorders or other issues. So how it is affecting the mental, how this mental health is affecting the overall health of the patient. So basically, the psychiatric team work as a liaison between medical team and the patient. Liaison psychiatry has an area of overlap with the other disciplines including psychosomatic medicine, health psychology and neuropsychiatry. Issues that arise include capacity to consent treatment, conflicts with the primary care team and intersection problem of within physical and mental health, as well as patients who report physical symptoms as a result of mental disorders. So these are the areas we usually make licensing psychiatry. Here, the patient come for a treatment. I know they brought to the hospital for a treatment, but then they are not giving consent to treatment. That may be a problem. That can be due to mental health issues, or they have both physical and mental problem, and we are unable to say why, whether the physical problem is causing mental issues or mental issues causing the physical issues. So then again that is another problem. Sometimes they came only with the physical symptoms. They may say that I have chest issues, chest problem, chest pain is there, but then when we conduct all other tests related to cardiology, nothing will be a problem. There won't be absolutely no problem with the patient. So it can be as a reflection of the mental disorders. Can be, that chest pain can be a reflection or a symptom of the mental disorder. Now, we will be talking about the history of liaison psychiatry. It is early origin, that emergence of general hospital psychiatry. In 1920, psychiatry became closer to medicine as hospitals started to establish psychiatric units. Edward Billings first coined the term liaison psychiatry. The concept of psychosomatic relationship and the role of emotions and psychological states in the genesis and maintenance of organic diseases emerge. This is another era, or this is another important part of the place where the concept came, psychosomatic relationship, because your your mind is related with the somato, that means your body. There is a relationship between mind and body, that's called psychosomatic. So this concept gained a lot of importance. That is actually reflected in the liaison psychiatry. Consultation liaison psychiatry became an applied form of psychosomatic medicine. Now, the first book is Medical Inquiries and Observation upon the Diseases of the Mind. The stress that diseases of the mind are certainly object of medicine as disease of the body. Benjamin Rush has said this. So basically, pointing out that body is related with the mind. In another concept also developed, psychobiology. That is again, it says that the study of the person in the context of physical, social, psychological life events. So this is a very broad term, psychobiology. When we talk about disease, we mainly related with the brain, and we related with the what and how it affects neurochemical changes and all this thing. But basically, we also have to think in terms of what are the social factors, what are the psychological factors, or anything, life events affected this person. It spoke of the medically useless contrast between mental and physical disorders. So this concept was developed by Adolf Meyer. Again, another Helen, she studied 600 patients with cardiovascular diseases, diabetes or fractures, and they said psychological factors appear to influence both the etiology and cause of illness in a substantial portion of this patient. She found that it is not that only cardiological or physical problems are affected by the psychological factors. So different prior to 1930, mental health services were only confined to mental hospital. Then different hospitals were started in Calcutta and many other places. The spectrum of psychiatric case materials seen in general hospital psychiatric unit is much wider than seen in mental hospital. This is another things we developed, because many of the patients are not straight away coming to mental hospital, they goes to general hospital. So the concept has actually generated that yes, general hospital also, mental patients also comes to general hospital, so we have to liaison. So that comes the development of liaison psychiatry, and we will be talking about the current status of liaison psychiatry in next class. So I hope you understood. So basically I was trying to explain what is liaison, the concept of liaison psychiatry and what is historical background. So next class we will continue. Thank you.